from 1 o'clock this afternoon. Now, do you remember Teresa's story? We first met her a couple of weeks ago when we were hearing your stories about the volunteer work that you do, and we were, quite frankly, blown away by her tale. Teresa's a dentist from Bracknell. She's been out to Morocco to help improve the dental health of children out there. She's just got back and we can talk to her now. So just for anyone who didn't hear your story the first time around, Teresa, explain what you were doing out in Morocco.
We were treating children at a school in a little village on the north coast of Morocco with a group of dentists from around the country.
And how did that come about? How did you get involved with it in the first place?
I got a call probably about 3.5 years ago now, from a guy who lives in Spain who does a lot of my marketing. His neighbour takes motorcycle trips to Morocco, and the daughter of the guy he was staying with had really bad toothache and came back and told Tony. Tony phoned me and said, can we do something? And we batted it about between myself and Tony and a couple of the other guys, and we decided to set up this Dental Mavericks charity. And we went out to Morocco the first time in 2010. It was all very haphazard that time because we really didn't know what the hell we were doing. And we were operating in the children's classrooms. And so, little chairs and trying to actually do treatment. But over the last year and this year, it's grown, and we've had lots of useful donations from local companies and from national dental companies. And we've actually got 5 portable dental chairs that we have use of, that we can take with us, which makes life a whole lot easier and saves our backs as well.
So what's the dental provision like out in Morocco? Is there any?
There is, but it's very patchy. The area that we're talking about is just north of the Rif Mountains. And in that area, there's one dentist conservatively for about 50,000 people.
Wow.
And considering most dentists in the UK will be looking after somewhere between 1,000 and 3,000 people each, that's pretty heavy going. So
what sort of impact does that have on communities then? What impact does that have on the dental health of children out in these areas?
Well, basically, they don't get any unless the parents have got money and can take them to one of the big towns and and pay for them to have dental care. There really isn't any national sort of health provision or anything like that.
But what sort of problems do you see then? So when you go out there, because we, it's commonplace for us to go to the dentist either on the NHS or privately, it's almost difficult to know how quickly your teeth could deteriorate, say even if you're a child. So what sort of problems do you see when you go out there? What sort of state are their mouths in, effectively?
Well, we were actually taking out first adult molars in 7, 8 and 9-year-olds.
Oh, my goodness.
Those first molars come through when you're about 6.
Gosh.
And the teeth we were taking out were decayed practically down to the gum.
Wow. How does it feel to be involved in something like this, though? Do you get more satisfaction out of doing something like that than you do, say, when you're practising in Bracknell?
Not necessarily more. It's different. It's ever so emotional. I really couldn't do it for more than a couple of days at a time.
Well, why so emotional? Is it that you sort of connect with the people who you're treating? Yeah. You get involved with their stories?
Yes, and also from my own story, my first visits to the dentist were very traumatic. At the age of 3.5, I had 7 teeth out. So I went through my childhood spending a lot of time at the dentist, and had a lot of teeth out, had a lot of painful treatment. So when I'm treating those children, I get very emotional because that's me.
Yeah, it's a miracle that you ever became a dentist based upon your previous experience. I'm surprised you're not scared to death.
Well, actually, I suppose to a certain extent, I'm still a very nervous patient, but it does help me empathise with my patient.
Yeah.
Because I know there's nothing I'm going to do to my patients that I haven't had done.
No, I guess so.
I've had root canal, I've got an implant, had teeth out. And in actual fact, I broke a tooth the second day we were in Morocco.
Oh, no.
A front tooth. There's a great picture on Facebook of me with a gap.
Who treats you when you break your teeth? Because presumably you can't treat yourself. You can't do anything about it yourself, can you?
No, that's right. Well, and also because we were out in Morocco, we really didn't have the sort of equipment to sort that out properly. So I went around for the whole week with a gap in my front tooth.
Oh no! Well, look, despite that, you've been doing some sterling work, Teresa. Really glad to hear that it went so well. That's Teresa, our dentist from Bracknell, talking about the work she's been doing in Morocco.